When it comes to medical research, there's a lot to actually go through. What I'm going to do today is try to divide the medical research into easy terms for you. We're going to focus on two types of studies, retrospective and then the prospective. Now, there's a whole host of different types of studies and sub-studies, but to keep things simple today, my goal is to try to explain major differences. In a retrospective medical research trial, the researchers are usually going through medical charts of patients. What they are trying to do is they're looking at participants with certain risk factors, and they're comparing them to a base group, what we call a control group, that does not have that risk factor. For example, they could look at body weight. They can look at a group that has a normal body weight and then compare it to a group that has a higher body weight and see which one of those two groups develops the disease that they're studying. Or for example, let's say they want to evaluate whether or not a disease develops in a patient that is taking a certain medication, such as a statin. They'll have a control group that does not take the medication. Then they'll have a group that actually does take the medicine, and then they'll compare the difference in both groups and their rate of developing a disease such as a heart attack or a stroke. Now, in a prospective study, they actually create the design of the experiment. They have two groups of people. They try to make sure in both studies that the control group of people and that the experimental group of people actually are as similar as possible, as far as factors can allow. So in a situation like that, they will try to control for gender, for age, and even for baseline medical conditions. Now, in a prospective randomized study, what they will do is they'll follow a group of people over a period of time, months or even years. And in studies like this, they're actually trying to link a cause between the development of a disease. When you go through these studies, both the retrospective, which look back, and then the prospective, which look forward, you will see that they are looking at as many and as large a group as possible. In a lot of your retrospective studies, the researchers will go through the database and look at all sorts of studies to try to create a large sample size. Sample size is important. It can lend statistical significance. Often in these studies, we are looking at hazard ratios, odds ratios of the development of a disease. And simply put, these ratios will tell you the likelihood of developing a condition. We are going to scrutinize how the study was conducted. It is very important that the study have a large sample size and that the conclusion they reach is statistically significant, which we will discuss in a later episode. But for now, understand that these two types of studies can actually have very different meanings. Although an observational study, which looks back, can show an association, it can't necessarily prove a cause, just a correlation. Follow me to try to better understand the science behind medicine. Until next time.